Hi, Dr. Milky back with my series on moving from the toes to the ankle and talking about places in the foot where pain happens. And where people come in and say, my foot hurts here. And it just makes it easy for you to maybe identify with, that's an area where your foot hurts versus like giving you a bunch of medical terms with diagnoses. I had a patient come in the other day, late 60s, having some pain on the top of her feet and, really active and said, I'm not old and I totally get it. I'm in my early 60s. So, certainly I don't feel old and, I want to just continue to be active, but I can't deal with this pain. And it pertains to where we're at right now, which is here in, I'll call this the midfoot. There's like 6 major bones here in the midfoot. We get past the metatarsal bones and we get into the midfoot. And this is a common place for arthritis, probably the most common place in the foot for arthritis. And it typically happens in both feet. It's very rare that if you're going to get arthritis, that you're just going to get it in one foot, unless there was an injury or something like that. But, just certain foot types are prone to that. And it just kind of shows up as pain, like the tops of your feet hurt, like in this area, not in the toes, not in the heel, not in the ankle, but, right here on the top. And most people don't really know what that pain is coming from until we take some x-rays and, dive deeper in terms of an evaluation of the area. So arthritis is real common here. There's a lot of ligaments in here, and ligaments are, little things that attach from bone to bone. So this red thing here would be an example of a ligament that attaches a tarsal bone to a metatarsal bone. Well, there's a lot of ligaments in through here that can become, damaged, or wear and tear can cause problems to some ligaments in through this area here. Of course, there's nerves that come over the top of that. There's some tendons that come from the foot, the leg down into the foot. Across the top of that can be a problem in this area as well. So there's a number of things that can go wrong here. A lot of joints, a lot of bones, a lot of things can happen, but arthritis being one of the most common. And, over the age of like 50 is where we'll start to see some of those problems. I've seen it even younger than that, especially if a foot type is like really flat. So, just again, if you're having some pain in this area here and you're over 50 and it's just chronic and it's both feet and, it doesn't even have to be a swelling situation or redness or anything like that, you may be dealing with arthritis. And there's a way to identify that on an x-ray and then to direct specific treatments to that. We'll see you next time.